As many of you in this room know, our special guest is a world-renowned pediatrician, founder and CEO of the Center for Youth Wellness in San Francisco, author and leading thinker around adverse childhood experiences. It is my genuine honour to introduce to you, Scotland, Dr. Nadine Burke Harris.
Thank you. Wow. It is such a pleasure and an honor to be here. And I'm going to try not to be nervous about the expectations and the hype and all that kind of stuff. But I wanted for this conversation to really be able to share with you all a bit about kind of my experience with moving through the movement. And, tomorrow I'll have a chance to talk and do a big PowerPoint and share with a larger audience. But today I wanted to have hopefully what feels like a little bit of an intimate conversation for all of you who I know are in the trenches, on the ground, doing this work every single day, so that hopefully maybe a little bit of my experience and what we've done with our team can be of some service or some use to you as you are doing this amazing work here in Scotland. So, a number of years ago, when I started doing this work, when I would go into a room and I would say, how many folks here have heard the term adverse childhood experiences? And literally in a room full of 1,000 people, 3 hands would go up, right? And I started by, just beginning to talk about, what ACEs are, the information from the ACE study, and why I felt like it was so important and critical for every single person to know this. And I didn't know that there would ever be a day that I would walk into a room and more than 3 hands would go up. I had no idea. But what I did know was that if I had anything to do with it, right, when I left a room, more than 3 hands would be going up. And over the past 2 decades since the original ACE study was published, there has been an awakening of our consciousness around the issue of adverse childhood experiences and toxic stress. It is beginning to be, right, and we're still early in the process, understood that when kids are exposed to traumatic experiences without the protection of a buffering caregiver, right, that this can lead to lifelong risks for conditions ranging from infection to depression to cancer. And this new science of toxic stress shows us, it gives us a couple of things that are really, really critical, right? One is that it helps us understand that this phenomena that we've been seeing for a long time, this notion that I sometimes describe as water is wet, right? Like, we all know it. You look outside, you see what it looks like. But to begin to understand and piece together, well, why is it like that? Why is it that when we're exposed to early adversity, that it leads to an increased risk of all of these different challenges and conditions? And we now understand that the fundamental mechanism is that when children are exposed to traumatic experiences without the adequate buffering of a nurturing caregiver, right, that leads to changes in our body's biological stress response. And these changes to the biological stress response, right, are what ultimately lead to long-term problems with both our physical and our emotional and mental well-being. And there are two parts of that that are critically important, right? And two pieces when I reflect on it about the ACE study. So one is that, particularly for me, before the ACE study came out, a lot of folks viewed each of the ACEs as being something distinct and different, right? And oftentimes we would even compare, right? Who had it rougher, right? Oh, well, you think you had it bad? People would, if you would look and say, what percentage of the population experienced sexual abuse versus what percentage of the population had a parent with mental illness or a parent who was substance dependent versus who experienced physical abuse, right? And we thought these were all very different things. And we treated them differently, and we understood them differently. And when you would look at each of them, at most, we'd see maybe 20% of the population, maybe 30% of the population, maybe a lower number is affected by each of the individual ACEs. But when the science showed us that the way ACEs work is that they activate our stress response, and that when we don't have adequate buffering, that can change the way our body stress response is wired, then what we recognized is that here in the UK, right, when we look at the data, we're then talking about half of the population who has experienced at least one ACE. Then we're not talking about folks who have, 10% of the population or 15% of the population or 20% of the population. We are reaching enough of a critical mass that people understand, wait a minute, this is something that we need to understand and we need to invest in solutions because this is all of us. The second thing about the ACEs that I think a lot of people were confused by, right? So one was you had lots of different experiences, and being able to understand that the biological phenomenon, that underlying biological phenomenon, is one common phenomenon. Then the second piece is understanding, okay, so you have ACEs, but how is it that it leads to all of these different things? Heart disease, cancer, depression, substance use, that just seems crazy. And when people don't understand how it works, right, then there's this tendency to discount it, right, or to assume or presume that maybe it's not real. And that's where the science of toxic stress, right, of understanding both the fundamental mechanism is this overactivation of the stress response, and the second piece is that when you have the overactivation of the stress response, right, it leads to changes in brain development, but it also leads to changes in the immune system, our hormonal systems, and even the way our DNA is read and transcribed. Why? Because our stress response is a fundamental part of our biology. It's wired into our survival, right? And so it affects just about every biological system in our bodies. Then we can begin to understand that, when we take a combination between our experiences and our individual, DNA, our family history, our makeup, and then filter that through, keep in mind that we have the effects of buffering and protective systems and relationships. Maybe we did have that grandparent that was able to be there for us to help to mitigate that response. Then we begin to see the range of outcomes, right? And it begins to make a lot more sense. So for me as a doctor, this science is fundamentally hopeful because it gives us the tools to better understand. And when we better understand, then we can better target our interventions. And I'll give you an example of what I'm talking about. So back in the early 80s, right, doctors saw lots of folks that were coming in and they were real sick, right? Coming into the emergency rooms, and they had tuberculosis. And doctor said, tuberculosis, I know that. I know how to treat that. It's, I'll write a prescription, send you out the door. And then they saw their patients coming in and they had this rare pneumonia, pneumocystis pneumonia. And they said, okay, I'm going to have to look that one up, right? But I know there's a treatment for it. I'll look it up, give you the prescription, send you out the door. And then they saw folks coming in with these weird skin lesions, a very rare type of skin cancer, Kaposi sarcoma. And they said, oh boy, okay, that's a toughie. I don't know the answer to that, but I know I have a colleague. I'm going to refer you to my colleague. That's my job. I refer you to my colleague. My colleague will treat you. My job is done, right? But what we didn't recognize, right, was that the tuberculosis and the pneumonia and the Kaposi sarcoma, we thought that those were the conditions that we were treating, right? But then patients kept on coming back, and they kept on coming back, and they were sicker and sicker because those conditions were just the symptoms of an underlying problem that was actually the root cause. And that underlying problem turned out to be a virus that was compromising the very immune system, HIV. And when we figured that out, and we said, okay, let's unpack it. Let's figure out the mechanism. It's a virus. No, wait a minute. It's a retrovirus. Okay, let's figure out how retroviruses work. What we were able to do was develop antiretrovirals. And in the course of 30 years, we went, in the United States, from a mean mortality of 6 months. 50% of people diagnosed with HIV in the early 80s were dead within 6 months. To now, at the point, on standard antiretroviral therapy, the life expectancy is greater than 50 years from the time of diagnosis. We did that in 3 decades. How did we do it, right? Understanding the mechanism was a critical part. But one of the things that we understand is that knowing the science is not enough, right? We also need to raise awareness. When we understand, okay, this is how it works, then we need to, we raise awareness and we spread the word about, hey guys, this is how it's spread. This is what you can do to protect yourself. These are some of the things that you can do, right, to reduce your risk. And what the science is telling us about adverse childhood experiences and toxic stress are 2 things that are overwhelmingly clear. And let me just say this. I will be the first one to say that where we are in understanding the science is early. We have a lot of work to do, right? But there are a couple of things that we know now that we can do now. The first thing that we know is that safe, stable, and nurturing relationships and environments are healing for children, right? That is irrefutable. That's the preponderance of evidence. When you look at all of the science, if there's one thing where we have a consensus, it's that safe, stable, and nurturing relationships and environments are healing for children. And if there's another thing that we know, it's that early detection and early intervention improves outcomes, right? So what does that mean for what each of us in this room is doing every day? It means that every single one of us has the opportunity to be part of the solution. Whether it's through raising awareness, whether you're a parent and you're talking to another parent, or you're talking to your child's teacher, or you are talking to your pediatrician, or whatever the situation is. If you're a medical practitioner, that's one of the things that I experience all the time, is that folks say, oh, what can I do? I'm not a doctor. I'm not a mental health professional. I'm not and you name it. When we understand about how ACEs and toxic stress work, then what we know is that there is a role for everyone. There's a child psychiatrist, an American child psychiatrist by the name of Dr. Bruce Perry. And I will tell you, recently in my life, probably one of the most exciting moments was I was sitting in bed, working, probably reading some research or something like that. I was working in bed, and my mom sent me a text. Turn on the TV. Oprah's talking about ACEs, right? So I turn on the TV. There's Oprah. She's talking about, literally, Oprah was talking about adverse childhood experiences. I'm screaming at the TV, oh my God, Oprah's talking about ACEs. And on the show, she has a child psychiatrist by the name of Dr. Bruce Perry. And I had read Dr. Perry's work. I was so excited about it. And one of the things that he says in his book, he wrote a really powerful book called The Boy Who Was Raised as a Dog. It's an incredibly powerful book. And he has taken care of kids who have been in some of the most severely traumatic situations, really, really severe. And he took care of the kids who were part of actually a cult situation in Waco, Texas. That was in the U.S. It was an awful tragedy. And what he said was that for many of the kids that he was caring for, some of them, they were able to be very effective with therapy. But some of the kids weren't quite ready for therapy yet. And he said, even for the kids who weren't ready for therapy, what he found was that every single adult in that child's environment had the opportunity to provide therapeutic interactions. Whether it was the FBI agent that was, safeguarding these kids, or the people who were serving them the food, or the mental health professionals that were working with them, if every single one of them understood how trauma affects children's developing brains and bodies, then every single one of them had the opportunity to provide buffering, caring, therapeutic moments for these kids. And that these moments are healing. So you know me, I take the brilliant research of Dr. Perry and others, and immediately in my mind, right, the question is, how do we optimize the cumulative dose of therapeutic moments in every child's life? And that means that everyone, from the bus driver to the checker at the supermarket to the teacher to every single adult, is aware of and understands about how ACEs lead to problems, right? And also understands their role. And in understanding their role, right, that means that when we're talking about more than 50% of the UK has been exposed to at least one ACE, and between 8 and 14% have experienced 4 or more ACEs, we're not talking about those people over there, right? We're not talking about the folks in another region. We're talking about us. And in order for us to be available to provide those buffering and therapeutic relationships, it means that we have to be able to recognize our own ACEs, and we have to be practicing self-care. Because this is hard work, you guys. And in order to change anything, we got to stick into it for the long haul. When people ask me right now, what is my biggest priority? There's a couple of things that I say, but one of them, and I'm really hardcore about it. My husband is here with me in Scotland. He's out for a bike ride right now because he's practicing his self-care. But one of the things that I'm really hardcore about is self-care. And the reason for that is in order to see the change that I believe is inevitable, the most important thing that we can do is just stick in it for the long haul, right? We just have to be there day after day doing this work. And over time, our cumulative efforts will change this nation. And in addition to staying in the work and being present, the other thing that we are doing is inspiring the next generation. I had the opportunity to meet a young woman earlier today as I was saying hello to everyone. And as we were chatting briefly, she told me that seeing my TED Talk made a transformative difference in her life. And this young woman, Rachel, she brought me to tears because that's what the work is about. That's why I went into pediatrics. That's why we all do this, because I had no idea, right, that when I got up that morning to do that TED Talk, that it would have an impact on Rachel's life. And a lot of the work that we do, a lot of the impact that we do, we won't necessarily have an opportunity to see it. It's not going to come up and shake our hands and tell us thank you. But the work that we are doing is life-changing for the next generation, and we just have to believe in it. There are a couple more pieces that I just really wanted to share, and I'll try to be more focused. I'm getting moved by the Spirit. I'm feeling very present. There's a couple pieces. Number one, the stress is toxic. Our children are not. Right? When I first started doing this work, it was in San Francisco. So many of the kids that were being referred to me, they were being referred for attention deficit, right, by their teachers who were saying, please, Dr. Burke, this was before I was married, please, can you take care of Bobby? Bobby's, can't pay attention. He's hitting the kid next to him. He can't sit still. He's running out in class. He's got ADHD. Can you put him on some Ritalin, right? And when I did what I was trained to do, and I did the history and physical, what I was hearing was so many of these kids, so many of my kids in that history part had such terrible histories of adversity. And as a doctor, for me, there was something missing. And so that's learning about the ACE science and how much early adversity affects the developing brains and bodies of kids, right? What that helped me recognize, right? So the first thing I did was in our practice, we did a chart review. We went and looked at all the medical charts. Once we read the ACE study, went and looked at all the medical charts. And what we found, I talk a little bit about this in the book, that among our patients, and very similar to the original ACE study, 12% of our kids, 2/3 of our kids had at least one ACE, 12% of our kids had 4 or more ACEs, right? And when we looked at the association between ACEs and learning and behavior problems, if a child had 4 or more ACEs, their risk of having learning and behavior problems was 32.6 times compared to our kids who had 0 ACEs. And what that told me was that these kids had been told that they're the problem, when our data was telling us that these children were showing symptoms of exposure to toxic doses of adversity. And when we understand, when we understand that, I sit down with my teenagers in my practice and I say, because of what you've experienced, your body, I believe that your body is making more stress hormones than it should. And it can look and feel like being quick to anger or having trouble controlling your impulses or getting sick easily when you're feeling overwhelmed. And the number one thing that my young people say to me is, "You mean I'm not crazy?" Right? So many of these young folks have been told that they are the problem, when we now understand, right, that their bodies were actually doing what it was designed to do, right? That fight or flight response that's supposed to protect you when you're in the forest and you see a bear, it's doing its job. But because of what has happened to you, right, it's a little bit more active than it needs to be. And so that means that what is our jobs now? Our jobs is to equip these young people with the tools to be able to recognize, okay, is this my stress response, looking after me? Is this a dangerous situation? Or is it just a little bit overactive? Because I know it's like that sometimes, right? Without the judgment, without the blame, without the shame, without all of that stuff. And say, okay, I recognize that when my stress response is becoming overactive, there are a couple things that I can do, right? And some of the things that I talk about in the deepest well: sleep, exercise, nutrition, mindfulness, mental health, and healthy relationships, right? So I know, okay, it's time for me to talk to my auntie or my grandma or my best friend or my therapist. It's time for me to go and do a yoga class or a workout or go play some tennis or go for a run, right? It's time for me to do some of that mindfulness and meditation practice that helps to regulate my stress response. And beginning to help folks, number one, and these are, I think, the two key elements. I think a lot of people all the time ask me, well, what's the intervention? What's the treatment? What's the one right thing? The single most important thing is the awareness. Recognizing what's happening to begin with. And once you understand and have this awareness that the fundamental issue is the overactive stress response, and that from there, any intervention that we do has to be based on calming that overactive stress response. So if you're a parent, right, that can be hugging and connecting and singing to and reading your child. If you're a teacher or an educator, that can be allowing the child to have a place where they can calm themselves down and allow their stress hormones to get back to baseline instead of engaging in punitive interventions that further exacerbate the stress response, right? If you're a mental health professionals are the ones, they've been working on this for longest, right? They have the most, there's so much that I've learned from my mental health colleagues about how to respond to trauma and recognize traumatic triggers and cues and how to be able to establish safety, right, and practice that self-care. And also importantly, if you are a medical provider, right? Now, a lot of my medical provider colleagues say, oh, okay, we identified ACEs and now our job is to refer. We have more work to do than that. In order to be able to make transformative change, in addition to doing the early identification, and I will just say this, I believe one of the most important things medical providers can be doing is routine screening so that we can do that early detection and early intervention. But what I notice is that when I talk to my colleagues about doing the routine screening for the purposes of referring to someone else, there's a lot of barriers that come up. Well, it's so difficult, and we don't have enough mental health services, and we don't have enough this, and it's really challenging. We don't have the right systems. And one of the things that my team is working on very hard right now is also understanding that if we know, right, which this is what the evidence is showing us, that early adversity, right, ACEs lead to this biological toxic stress response, then that means that there are also ways in which we have to change our medical care, right? There are also ways that we have to be thinking about what medications we're prescribing. A great example, we know that kids who have high ACEs are at increased risk of infection, right? Now, we recognize that behavior is the canary in the coal mine, right? So when kids come in and they have troubling behaviors, those are the kids that get identified. But I almost want to say, what makes me really sad is that a lot of the times, those are the lucky ones. Because their behavior makes it so that we grown-ups can't help but say, well, okay, there's something going on there, we at least need to identify it. But there are so many children who are suffering in silence, who don't manifest any behavioral symptoms, right? But they come in with terrible asthma, right? They've got rashes. They have infections. And in the book, in The Deepest Well, I tell the story about Lila. And you guys know this, but I really have to say this. Literally every single story, patient story in the book is true. So Lila, this 3-year-old girl who came in to see me, right? And she was itty-bitty. She wasn't growing. And her height, her weight, her head size was at the 3rd percentile. And when I looked, because we screen universally for ACEs in our clinic, when I looked at her ACE score, it was a 7. And you never would have guessed. And she had no behavioral problems, right? And when I sat down with her mom and I said, I think that because of what your daughter has experienced, I'm worried her body's making more stress hormones than it should, and I think that's what's interfering with her growth. And to see her mom, she was just nodding. Right? And I said, oh, have you heard this before? And her mom said, no, I'd never heard of it, but it just makes complete sense to me. And this mom, who had been in a terrible situation of domestic violence, she was able to do for her child what she had not been able to do for herself. Because when she recognized, right, and for all of us who are in the room as parents, you kind of get to that feeling. When she recognized that what her child was experiencing was harming physically her child's health, she said no more. And in that particular case, she ended up filing a restraining order. She ended up getting care for herself because she had a very high ACE score, which was part of what was interfering with her ability to create and maintain a safe and nurturing environment for her kids, right? But guess what? The story doesn't end there. So, I tell the story in the book, and, Lila, we do this intervention. We do parent-child therapy for Mom and Lila. We have the restraining order. Dad leaves the house. And Lila's growth picks back up. She's back on the growth curve, right? And by the way, I just have to say this. I know I'll say this, and then I'll say 2 more things, and then I'll wrap up. But I just have to say this because I have to say this to all the medical providers out there. When Lila first came to see me, her growth velocity was 2.3 centimeters per year. Right? She was 2 years, 9 months old. And normal for a child of that age is 8 centimeters per year. When we were done with our intervention, a year and a half later, Lila's growth velocity was 7 centimeters per year, and normal for that age, because now she was 4, was 6 to 7 centimeters per year. I am talking about changing the rate at which her long bones grow. That's what I'm talking about in terms of changing our medical care to incorporate ACEs. But the other great part of that was that Lila's brother, who had 4 ear infections and 2 pneumonias in his short 9-month life, when we started the intervention, by the time we were done with this family intervention, he had not another ear infection and not another pneumonia in the year and a half following, right? So for us as medical providers, we are talking about reduced morbidity, like reduced health problems, right, for these young people. But the interesting part of that story of Lila and her family, is, and in the book it stops there and you don't know what happens, but in real life what happens is that I wrote a letter to the court, and there's proceedings, there had been restraining order, there had been child protective services involved, and ultimately what I said to the judge was this: not Dad's a terrible person, because it turned out, who do you think had the most aces in that family? Dad. Not Dad's a terrible person, not Dad's whatever. It is, these children must be in a safe, stable, and nurturing environment. And unless they are, their caregivers must be capable of providing them a safe, stable, and nurturing environment. So you know what the judge did? The judge mandated that dad to do trauma-informed work around his own ACEs. And this dad also wanted to do it because he was very motivated to reconnect with his kids. And this dad, and this was something that was very moving to me, said to his daughter, I am so sorry. I hurt you, and I hurt your mommy, and I am working on healing, but I am sorry for what I did. You want to know how many people who need to hear that? You want to know how many, the opportunity to say, wait a minute, the story doesn't end with the bad dad who goes away. The story continues with this dad recognizing and addressing his own ACEs and understand how ACEs have impacted the way that he responds in his household. Because there are times for him when his own family members might be the bear, right? And so this is why I do this work, you guys. This is why I do this work, because at every step of the way, we're talking about changing lives. And so the last thing that I'm going to say is that this work takes all of us. When we think about how we respond to ACEs, when we think about Scotland becoming the first ACE-aware nation, we recognize that for many of us it may feel overwhelming. It may feel like, how are we going to change this in our each in our individual field? And that's kind of when we started our program, that's how we all felt on a much smaller level. So I'd be as a doctor in the exam room, and I'd have this really difficult case, and I would say, God, I just don't feel like I have the tools to do this. And we had a social worker in our clinic, and she was doing her social work stuff. And we had a psychologist, and he was doing his psychology stuff. And then, one day at lunch, I was, pardon my language, sorry for the young folks, bitching and belly aching, right, in the break room. And I was like, this family, I'm struggling. I don't know how to help them. I feel so frustrated. I feel so powerless. And our front desk receptionist, she said, you know what? I see that family on the bus every morning on my way to work. And then the social worker said, well, if you see that family on the bus, would you let them know that I have these resources for them? And then our psychologist said, and you know what? We know that there are interventions that'll help that family, and tell that mom to come and connect with me, because I can help the mom, and the social worker can connect the family to resources, and our receptionist sees that family every day on the bus. And so we created this thing called Multidisciplinary Rounds, where instead of, even with our own clinic, we were all working in the same place, right? All trying to serve the same families. But when we got organized in creating networks, right, in having a regular way of saying, hey, let's figure out how we're providing services so that I don't have to feel like I have to be everything for every family. And we coordinated our care. That's how we came up with Multidisciplinary Rounds. And our care was much more effective. And now what I see when I go across the country and the world and I talk, folks in education say, oh my gosh, how are we supposed to respond to all of these challenges? Should we be screening for ACEs in school, right? And then educators say, well, I can screen in the clinic, but I don't see kids every day, right? I might see them, at the most once a month. What am I going to do about all the intervening issues, right? And the folks in early childhood said, well, we see kids when they're little, right? When they're most malleable, they have the greatest neuroplasticity, but then we don't see them after that, right? And the folks in the justice system says, well, we get these kids after they've experienced all these years of ACEs, and so, we can try to put in trauma-informed systems, but, how do we undo the years of what's been done? And you say, no. We don't all need to be the be-all and end-all, right? We can say, let's coordinate amongst each other, right, amongst ourselves. We'll say who's going to take what, and figure out we each do our little piece, and we do it informed with this basis of a shared understanding of agenda of what we're all trying to solve for, right? A recognition of how ACEs affect kids' developing brains and bodies, and every single one of us does our part to be part of the solution. And then hopefully that reduces that feeling of overwhelm, and you realize, you know what? I don't have to do everything. I just have to do my little piece. I'm going to practice some self-care so I can do it for a really long time, and I'm going to coordinate with others so that I can make sure that every child has the opportunity to have just the potential to grow up, to live out their God-given potential. So I want to say thank you guys so much for listening to me. I know we have another wonderful speaker, and I'm just very, very much looking forward to this conversation.
Ladies and gentlemen, Dr. Nadine Burke Harris. Thank you.